So prior to transplant, you want that history and the exam of the patient. It's important to know about um, any acute or chronic infections this patient's had recently, any history or indication of cancers, obviously presently or in the past, and any risk factors that are going to make them more at higher risk for infection or for cancers. Just things like poor nutrition and smoking, they're going to put them at a higher risk of cancer. And then what's your clinical management for this patient? You have to teach them about the correct administration of these drugs. And what is the correct administration? What's important about this? The consistency that these medications are taken. So they need to be taken in a consistent manner. That's right, on a schedule. So the same time of day. You also need to you need to take the medication as soon as possible if you miss a dose, unless it's within just a few hours of taking your next dose. And if that's the case, then you need to notify your doctor to get instructions on what they need to do. And also avoid taking any other medication, including anything over the counter or herbals, unless they're approved by your transplant specialist. You need to recognize those early signs and symptoms of rejection. What are those? Okay, believe it or not, fever is a rare sign. They start to just not feel well. They're extremely fatigued. They'll have flu-like symptoms, so they'll have those chills and the headache and the body aches, nausea. They do have pain and swelling in that area. Also, one of your big signs would be, depending on what organ it is, the function of that organ. So like I talked about earlier, the kidney has the urine decrease. Yeah, fever is a rare sign. It can happen, but it's rare. So if your kidneys decrease urine output and you're having edema, then you're probably not having very good kidney function. There's probably something going on with that organ. Your liver, what if your urine's really dark? Your liver, what if your urine's really dark and you have these light color stools and you're jaundice? Your liver's probably not working well. Heart and lungs, shortness of breath, you're having circulatory issues, coughing. You also want to teach them the importance of keeping their appointments for lab tests, because they need to be able to compare results from baseline and then track the trends. You want to educate the patient on the adverse side effects of these drugs. They need verbal and written instructions on each drug. You need to teach them about the drug-to-drug and drug-to-food interactions. Ginseng, St. John's wort, they affect the immune system and they should be avoided. Grapefruit juice will alter the absorption of some of the immunosuppressants, so they should be avoided. These patients are usually quite complex patients and they're going to multiple doctors, so they need to make sure they carry a written information with what medications they take and the times of day they take them. And also carry it with them in case of emergency. And then infection. So what are we going to help them do to prevent infection? They're going to have to avoid those exposures, maintain their healthy lifestyle, take prophylactic antibiotics as prescribed. And they need to report infections or signs of infections immediately. Fever, pain at the organ site, thrush, poor wound healing, all those things need to be reported. These patients also need to be on neutropenic precautions. You need to dig way back in your brains and think about neutropenic precautions. What are some of those things? No flowers allowed in the room. Wash hands, cook all meats, isolation room. Good. Okay, so they need a private room in the hospital with a filter. You're doing neutropenic precautions for infection management. Okay. At home, they need to minimize contact with others, so they need to make sure they wear a mask when they're going out in public also. Frequent hand washing, not only of the patient, but also people they're going to come in contact with. Obviously, avoiding exposure to a person who is sick. Avoid live vaccines, yes. Good oral health, that's right. They need a soft toothbrush and frequent oral care. They also need stool softers. Avoid fresh fruits, vegetables. Yes, they need to avoid crowds also. So what about adherence to drug therapy? How do you help them adhere to that drug therapy? So non-adherence is obviously going to lead to them to have a high risk of organ rejection because they're not going to be on their immunosuppressants, which is going to allow their body to try to fight this organ off. It's the fresh fruits and vegetables because of what's on the outside of them. You don't know where they were farmed with pesticides. A lot of bacterias and parasites can live on the outside, so you want to make sure all your fruits and vegetables are peeled and cooked thoroughly when you eat them. Okay, so what about adherence to this drug policy? Time of day? First of all, don't you need to at least know what their ability is to understand and comply with their treatment? Establishing a routine at home and around their lifestyle. So a drug schedule. All those reminder aids like the pill boxes, the calendars. Yes, returned information before discharge and also involve their family in teaching. Make sure you explain the rationale for the medication and the importance of taking the drugs to prevent rejection. How are we going to minimize side effects of those meds? And stay hydrated, right? Take them with food if GI upset occurs. What else? I'm actually not sure about taking Benadryl, like if they have a side effect of something, because depending on what they've had transplanted, if it's been a kidney transplant or something, they're not going to be able to filter all that out, or a liver transplant. So because they're already going to be on so much medication, they'll want them on as least possible. Yes, no over the counter. You're welcome. Okay, now I have some questions for you. Okay, following the liver transplant, the patient is prescribed oral prednisone, cyclosporin, and a monophenolate, which is CellCept. Using an approved drug reference, what teaching should the nurse provide regarding the patient's self-administration of these drugs? The basics are we know they have to take the drug at the same time every day, right? If the patient forgets, you're supposed to take as soon as they remember. And if longer than halfway through the next dose, they need to notify the doctor for information. Now, CellCept must be taken on an empty stomach, and the capsules have to be swallowed whole. They cannot be opened and dissolved in anything. If they take an antacid, medicine needs to be taken 2 hours before or after the antacid. No grapefruit. And for patients that are on the cyclosporin, which is the Sandimmune, there's another formulation. It's NeoOral and Gengraph, and they're also cyclosporin formulations, but because they're not equivalent to Sandimmune, you need to make sure that they take the exact Sandimmune brand. And with this medication, you need to measure it out, obviously, in the syringe that's provided, but it goes into a glass container. And you can add, or a glass cup, and you can add orange, apple, you can add milk, you can even add chocolate milk to it. They need to take the medication, and then once they finish the liquid that's in the cup, they need to pour more water into the cup and rinse it around, and then finish it to make sure they get everything off the sides and the bottom. The Sandimmune you can take with something to alleviate GI distress. Sandimmune is the cyclosporin. You also want to have labs when you're on the cyclosporins to ensure that the immunosuppression is adequate and that you have a level of cyclosporin in your system all the time. And it's also nephrotoxic. So you need to follow your labs. You need to follow your BUN, your creatinine, your potassium to monitor. And don't take other prescriptions or over-the-counter medications without first letting your transplant specialist know. And I wrote it all out for you for whenever I send you the PowerPoint. Okay, another question I have for you is the patient is prescribed, oh, you're welcome. The patient is prescribed CellCept following a kidney transplant. What lab test should the nurse expect to monitor and why? Okay, so let's say a white blood count. Why are you looking for a white blood count? It's a post-transplant patient. Immune response, right? So you're looking for that risk of infection or leukopenia. You're going to monitor the platelets for thrombocytopenia. You're going to monitor your red blood cells, hemoglobin, hematocrit to watch for anemia. Your urinalysis for UTIs and hematuria, so blood in the urine. You want your electrolytes. You're going to look for hyper or hypokalemia. And then for patients that are on CellCept, female patients on CellCept, pregnancy tests need to be done. CellCept causes fetal abnormalities and miscarriages. Okay, and your last question. So you have a patient who has the following labs. They have a white blood count of 3,000. They have 10% segs and 2% bands. How would you interpret these findings and what interventions should be implemented? How do you figure ANC, the absolute neutrophil count? So your ANC tells you whether or not you have neutropenia, and anything less than 1,000 is considered neutropenic. Okay, and that means you're at a risk for a serious infection. So you calculate it by adding your percent of segs and your percent of bands, converting that to a decimal, and multiplying by your white blood count. So there we have the 10% and the 2% is 12%. With me so far? Change it to a decimal, makes it 0.12, and multiply it by 3,000, which was your white blood cells, and you have 360. Definitely less than 1,000, isn't it? So this patient now has your neutropenic precautions. So you know this patient is at risk for serious infection, and your neutropenic precautions should be put in place. And what did we say some of those were? We just went over them. The private room, the minimizing contact with others, patient washing hands frequently with people they come in contact with, avoiding exposures to someone who's sick or has an infection, oral care, so soft toothbrush, frequent oral care, stool softeners, avoid fresh fruits and vegetables, no live plants, no flowers, that's right. Okay? Now, what do we need to go back over? Have y'all done, it's not required, I'm just asking, did y'all do any of the extra questionnaires I put in PrepU? And if you did they help? Okay, good. Do y'all want me to do some more for these? Okay. It doesn't give you the answers back. I'll do a raising the bar. Yeah, I'll do a raising the bar. It doesn't give you the answers at the end of the other questions that I sent you, but if you'll just send me the ones you got wrong, I'll send you the answers to them. No judgment. I don't care if you got all 62 of them wrong. Just let me know, and I'll make sure you know the right answers. Oh, good. I'm the one who started the raising the bar about 6 years ago, and then I was out for illness for 2 years, maybe almost, 2 years. And I don't know what happened to the raising the bars. I've seen some of them and I'm like, oh my goodness, those aren't mine. But I hope they do help you. I feel like it gives y'all a little bit of an outline to kind of study from. Good. Do y'all have any questions about today? It didn't tell you which ones were wrong either, you said? Okay, let me okay, let me go in. I guess I can look and see, and I can send it to y'all. Okay. Oh, it says the 22nd? Well, that's no good. Okay, let me go in and fix that. I may have to change the date to when the last time y'all can do it is. I just set it up until the day of the exam, but if I put it in, whenever I close it is whenever they'll let you see it, I guess. So I'll figure that out. And I'll send y'all an email to let you know whenever I'm going to close it so y'all can see the answers. Does that work? Okay. Who needs a refresher on how to get into ExamSoft for your test? Or let me put it to you this way. Would you like for me to do a time between now and Monday, just 15 minutes so that Miss Lisa Rattan from the testing center can get on Blackboard and walk y'all through logging on to ExamSoft to make sure that everybody can get in and they don't need any type of, yeah, you're doing it from home. And make sure you don't need any type of software update or anything like that. Yes.
So I'm in Miss Gray's clinical group and we're testing on Tuesday. We got an email saying that we're doing it from, we have to go into the testing center. Is that correct?
I don't think you have to.
Well, that's where I'm confused. I thought it was an option, but we all got an email saying you will be testing Tuesday at 8 a.m. in the testing center. So I was confused if that was only meant to go to the people that requested it or if that was supposed to go to all of our group.
Let me check on that, and I'll email you back and let you know. I would think that I'm pretty sure you can do it from home if you want to do it from home, but I'll handle that in the next few minutes when we get off, and I'll let you know for sure.
Okay, thank you.
You're welcome. If you don't hear back from me, send me a text message or an email. Okay, all right, y'all. Just if you don't hear back from me in just a little bit, send me a text message or an email. Okay, so now comes the question if y'all want to do a refresher on ExamSoft. And all y'all schedules is different, I know. When would you want to do it? Yes, Fantana?
So I have a question about the exam soft download. So the ID that Dean Becker sent us, it doesn't work. And should I contact the ExamSoft IT or should I email her back? What do you think?
What is it, the ID to get on?
Yes. It says wrong ID or something. I tried many times. It didn't work.
Okay, email her back and tell her it's the wrong ID, and I'll follow up also.
Okay. Should I copy you too or just her?
No, you can copy me. Yeah, that's fine. You can copy me on
Okay. All right. Thank you.
You're welcome. I mean, it's Thursday, Friday, or one of those days work for y'all? I know some of y'all have clinicals. If I would rather not have to do it twice, but if it has to be done twice, that's fine. It's not because of me. It's because I'm having to get Ms. Rattan from the testing center on it. So I would rather her only have to do it once. But I know y'all have lives. Thursday, morning, afternoon, evening. Knock on wood, Catherine. Okay, let me get with Miss Rattan and see when she can do it, and I'll send y'all out an email this afternoon and let you know. I know I'm hoping there's not any updates on your computer or on the ExamSoft side. But again, if something happens when y'all are testing on Monday or Tuesday, whichever day you test, you should have my cell phone number. Text me or call me and let me know what's going on, and I can extend out your testing time, and I can see into ExamSoft and see what's happening with you also. So don't stress out. Don't go into a spiral because you can't get in. Did you update it and then it allowed you to go in, Catherine? Okay. And it allowed you to go in, Ashley? I think they may stay on there the whole time you go through your exams. Okay. All right, so I'll check on those things for y'all. I'll get a time with Miss Lisa. Is there anything else? Yes, ma'am.
Ms. Raljak,
Uh-huh.
as far as the remediation for submission goes, are you going to be okay if I copy and paste it on one page instead of taking a picture? Picture is going to be too many. Like,
Will I be able to tell it came off the HESI site?
I'm sorry?
Will I be able to tell it's from the HESI site?
Yes. I mean, it shows,
Okay.
I mean, if I copy it like from the page, it would show Hesi and my name.
Okay. Okay, that's fine. If I have a problem with it, I'll let you know, but go ahead and do that.
Okay, thank you.
Okay, and then the ones of y'all that have zeros for that, I'll go in there and have that column fixed. It won't be a 0, it'll just be a check mark. So you're not starting off your nursing with a 0. That will be helpful, won't it? Yes, there's 50 questions on this test. And then it goes up each test. And please, 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 when you're studying, if you have any questions or you don't understand anything or just want a refresher, reach out to me. I don't mind. That's actually what I'm here for, believe it or not. So just let me know. There are a few math questions. I think there's 2 math questions, if I remember correctly. Nothing crazy. Not rocket science, just a few calculations. Okay, I'll make sure signature policy doesn't say 0 either. Anything else? Yeah, so it's actually interpersonal and then cognition. So cognition is the TB part, and interpersonal relationships is all the psych stuff. Okay, good. I'm glad it helped. I try to do those things for you. If it doesn't help, don't feel bad telling me it doesn't help because I can find something else to do extra for y'all. I just feel like the more you see the information and see that style of questioning it, I think it helps y'all apply the knowledge. Or at least I hope it does. Okay, so y'all are done a few minutes early today. It makes up for me going late last time. If you need anything, reach out to me. I can help you, but just remember I can't help you after that grade's already posted. So if something happens that morning, you're taking your test or before you take your test, please reach out to me to sit down before taking that test and getting an F on it. Okay. Yes, next is gas exchange. And I'm so glad you said that. I'll make sure there's something in Blackboard. Are you sure it wasn't on with another, like the week before it? I'll have to look. Reagan, you promise? I can always help y'all before, but I can't help y'all after. Or it's a lot harder for me to help you after. I'll say that. Okay, no, that's okay. I'll go in and look. I'll actually do it right now when we get off. Okay? Bye. Yes, good luck on y'all's test. Let me know if you need anything.